Welcome to this week's episode. We are doing a medical device sales case study. We're going to review a real life example that I made up. I'm going to give you information about the hospital, the accounts, and the device, and we're going to dissect it down and have an engaging conversation to hear what thoughts you would have to drive growth and what actually happened. This is really cool because in med device sales, you don't really see case studies. You know who the big dogs are and who's doing well, but it's really hard to get into what they did at a specific account for success. And I think that's important because what you can do at one account, sometimes you could replicate at other accounts. But more importantly, what you can do is take different skill sets that you learn from that account and use those in another account. What I found out, there is such different hospital systems, physicians, product preference, that it's not rinse and repeat, but different successes you had, you can take out little components for the next account. So today, we're going to dive into a medical device sales case study. I'm going to present the facts about the device, the physician, and the hospital, and I hope we both walk away learning something. And I think a goal in your medical device sales career is President's Club, and that's usually the top 5 reps in the United States that are acknowledged at the end of the fiscal year, and they're invited to a tropical island, usually Hawaii or somewhere in the Bahamas, with all the senior leaders at the company to celebrate that accolade. So if you talk to anyone in medical device sales, everyone is eyeing the P Club award. And people want it not just for that tropical adventure and hanging out and having fun for the week with all expenses paid, but on your resume, if you say P Club 2025, 2026, it's the designation that you are a top sales rep, and that sometimes gives you the green light that you've had the success in sales and you could go into sales leadership. Some recruiters or hiring managers, if you're trying to get into those sales leadership roles and you don't have P Club on your resume, it's an instant. So today, let's talk about a medical device sales case study. And what we're selling is a widget, and this widget saves lives and improves symptoms. If you're not using this widget, unfortunately, patients can die early and they can suffer from cardiac symptoms. And the account we're going into is what I call a low volume, low share. So your presence is not really felt. They're not really using you too much. In the last year, you've been there 4 times. And the overall volume or revenue potential for this account is not high, but it is low, and you need it. So the first thought in a lot of people's minds, why bother? Should we even engage this account if it's low potential and we're really not doing anything? So let me provide this fact before I move on. The fact is, this hospital is part of a big IDN, and that's a group of hospitals in the United States. And even though this is low volume for your territory, it represents a significant opportunity for your company. So there's senior leadership engagement at the high level and encouragement to get any traction at these accounts so that the system can win. You also have a new widget with expanded features coming out in 3 months. And your operators, you have 2 main physicians. One that has used you a few times and seems to like your widget for the clinical data, and one physician that used you once in the last year and mentioned that he was more interested in procedural outcomes, so some of the data, but also a safe procedure. So knowing that, I wouldn't ignore this account. We know that it is low revenue, but it is important for your territory plan as you create a path to plan and success for this quarter in the future. And you also know that your corporation is positioned well with this IDN where they need every single account to participate with your widget, use your widget, and you find out that there is a IDN contract where if the system uses X%, let's give it for this case study 30%, that each facility will receive a discount on those widgets. So let me give you a little more details. Your product is second to market, so it's not the incumbent. Your clinical data is strong, and recently there was another announcement that some physicians are finding favorable for your product. You have a new product coming out in about 3 to 4 months per your R&D's timeline. This account has had good outcomes for the past few years with your limited device use, but there's been a lot of turnover at the rep level, so they haven't really felt comfortable with the company you represent or having someone that's been there and really understands them. You have access through one of the nurses who provides you with a lot of information about how they're selecting their widgets for their patients and giving you updates. Your access with the physicians are really limited. You have their emails and numbers, but typically they don't answer your phone calls or your texts. How do you go about this? You're tasked with driving revenue, widget implant utilization at this account. What do you do first? Do you charge in with the recent clinical data? Do you start championing and banging the drums for this new product that's 3 months out that you don't know much about? Do you focus on this quarter and getting implants maybe at the detriment or the success for the future? Or do you create a strategic plan for the launch of the new device? What I would think about is, as the new rep for this account, you don't have really much relationships. You have one nurse, their contacts, and their emails. You can talk to the historical reps to get some more feedback. And that's what I would do first, is get as much intel as I can from your internal team, maybe the sales leader or past reps if they're in different roles, and external information. So I would talk to the internal reps. You talk to the manager, you talk to the old sales rep, you find out they've had good outcomes with your device. They're just not very comfortable because it's a little bit different than the widget they typically use. And they had one issue with a referring physician with your device. There was one issue where the referring physician wasn't happy, not to go too specific. So now knowing that, you could craft your sales strategy around how to address that perceived problem. You also talk to the external customers. You email the physicians, you're not getting much feedback, but you talk to the nurse who is very open with you and says, we had this one case and a referring physician came in and wasn't happy about this one perceived issue. And that validates what you learned from your own team. And then you realize that the product that's coming out in 3 months, and you just got an update from R&D that you are launching and you are approved at this account, which is great because contracting and getting through R&D can take a time, but in 3 months, 100% that your product will be ready for use. And that product addresses the perceived issue that the implanting team has, as well as that referral. So knowing that and asking questions and getting the information, we could start building our sales strategy. Your sales manager wants you to start getting revenue now, so think about how you can do that. And what I would do is look at the historical cases in the last 12 months and what cases did they use your widget for. Can you carve out any of those for the foreseeable future to show stability? But in the back of your mind, you start thinking about 3 months, how to start getting ready for this new product launch that legitimately answers their biggest concern. And sometimes sometimes physicians will say, oh, this is an issue, or that's an issue, or whatever. But really, maybe it's not the issue. So you ask really good questions to uncover what their main pain point is. And in this case, you validated with your internal team and the external team, the customers, to realize that this is their main issue. And in those conversations, you heard that they're very comfortable with this widget procedure, be it the competitor or yours, but there's some nuances that they don't understand about your device that they would like to understand. So, 3 things. We start targeting cases that we typically won for our widget in the past 12 months to get our foot in the door. And that's going to give us the ability to have conversations and find more information. Second, you start getting ready for the launch of the new device and addressing how it can help their perceived issue. And you want to start a launch for that. And when the device is allowed or approved, you want to do a case study where you're doing 2, 3, 4 widgets so that you can build the repetition around this device. And 3, I would draft some sales emails to an in-person meeting to go over your procedure. Or set up an in-service. You want to simplify the procedure so when they're doing it, it's easy for them, and you build that rapport that you could walk them through the case. And that way you could build out their character profile and understand how you could help them. So our short-term sales strategies to get in person for an in-service. We talked about some sales emails to get some traction and then recognize your name. First thing we need to do is get into the hospital by setting up an in-service, which is typically common. You leverage your nurse contact to help you do that. You meet the cath lab team. You say thank you to the nurse. You bring lunch. And you're able to catch one of the physicians, the one that has used you more frequently. They're happy to connect with you. They mentioned that they're impressed with the clinical data, but they just haven't found a right case for your right widget use. And they didn't know about that upcoming device release that you are really excited about. So you do a couple things in this meeting. You asked if there's any potential cases for you, which you said, hey, in the last 12 months, I saw that you're using our widget for these patients. It seems like you're finding benefit. Do you have any of those upcoming? They say no. You do get their contact information, and you also ask for the contact information for their partner physician so you can reach out and introduce yourself. And you start seeding for this exciting launch. And during that, you bring up a couple of things. You talk about the price discount, that your device would be 20% discounted compared to the competitor, which you thought would be a huge lever. And they let you know they're not really driven by price. They're driven by clinical outcomes, clinical evidence. So it's good for the administration that you have the discounted price, but now you know with this physician, as this is a physician preference device, that you need to drive on what they said, which is clinical evidence and good clinical outcomes. And during this meeting, as I said, you seeded for the future, you start thinking about your plan there. So let's regroup. You leave the in-service with a lot of wins. You did not get a case, but you do have the information needed for the future. And what you do is in a few weeks, you send a reminder email about the product and when it's going to be available. And perhaps you want to ask if they want to connect with a peer about their experience. You realize that the European market has your widget first, and you saw that the physician you're training with or working with went to training with this person, and you thought, this would be great. We could have a peer-to-peer conversation. Maybe I'll see if that's an interest. Turns out it's not. But they are interested in reviewing the procedural steps. So you set up a meeting in their office to review the procedural steps. And what they specifically ask for is they want to do a hands-on simulator. So you think about, what resources do I have? And you're like, oh, perfect. I have a technical person on my team that could do a simulation, bring in hands-on equipment. So I'll set up that for their lunch. And that's a second major in-person touch point. You're also working with the nurse, educating her on the next device that's coming. And the second physician, you do have their number and email. You've been trying to find a way to get in front of them. So coming down the pipeline, you set up an in-service, now not in the hospital, but in the clinic, to do a hands-on training with this physician to answer any questions. And during that training, your goal is to find out any information, ask a lot of questions. You have three goals: to make sure they understand your procedure. Even though it's the same widget procedure, there might be some nuances to your device. You're going to find out information from this operator about what really drives them. You heard earlier that was clinical data and clinical evidence, but is there other things? And you also learn the nuances during their technique about how they go about it. And third is, when your foot's in the door at the clinic, can you go find and introduce yourself to the second physician and have similar conversations, try to figure out what they need. You do that, it goes well. They're starting to get comfortable with you. They've seen you a couple of times, they're reading your emails, and coincidentally, you get a page from the nurse saying, hey, we saw this patient that seems to be good for your widget. Would you like to evaluate them? Of course. So you evaluate that patient. It's an excellent patient for your widget. It's the hallmark. So you are scheduled for surgery for your widget, which is awesome because you haven't been there in a couple months, and it's your first case as a rep as you build towards a new product launch. So let's talk about that. You're going to be in person working with the physician for an hour. So you need to be prepared. And in this case, I'll make sure that you bring the appropriate clinical team. And that could be you, it could be your clinical specialist, it could be a senior clinical specialist, whatever you do to make sure that case runs smoothly. Given that they haven't seen you in a few months or know your widget that well because they only use you 4 times a year, I would do everything I can to make sure that case goes smoothly. And what I mean by that is making sure the room's set up, so getting there early, making sure any accessories that they might need for your widget or for this procedure is identified and in arm's reach of the procedure. You're also going to work with the scrub tech who helps the physician, the OR assist, to make sure they understand some nuances with your device. For this case, for you, I wouldn't focus on sales or pushing more revenue. My biggest goal for this case is this. I want a good clinical outcome. I want the case to go smoothly, and I don't want there to be any hiccups. So I'm not going to have sales discussions before the case. I would have sales discussions in the sense of I want to make sure they reviewed the patient that I worked up, evaluated for our widget, and if there's any questions about our procedure, please let me know. and I want to be a clinical trusted advisor. I want to have a good case, and then at the end, once we have a good case, I would do more of the true peer sales, talking about, this was a really good case. What were your thoughts on the widget here, or how are you finding value in our widget? But also connecting it to the future device. I would also take the time to linger after the case to meet with anyone I can, or maybe the second physician, to see if I can glean any more information. A lot of sales is just being around people, kind of being in the right place at the right time, but just learning and tailoring your sales strategy to that. So we have a good case. Your team's happy because it's our first case in a while. So your sales manager is high-fiving you. You didn't sacrifice anything in the short term. You didn't come off pushy or salesy. You're working with them and you're delivering a product that you know is going to be a win. Now that I keep saying it was 3 months, but now it's ready. So you got one case this last quarter. The new quarter starts, and you've done everything you can to educate the physicians on this new product. Make sure they understand that the procedure is the same as the old widget, so there's no concerns there, and that you want to identify 2 cases that they could hold off for your launch. And they do that. They hold off 2 patients for launch, so they could be one of the first hospitals in the IDN to participate. And they have, again, 2 excellent cases because you came in and prepared the lab. You brought in your excellent clinical support team, and you just had a rock star day. You also brought lunch so you could educate about your device, but really just provide lunch to the staff and say, hey, thank you. I know I'm a new face. I'm asking for different products. I thank you. I appreciate you. And that goes a really long way. The cath lab staff works so hard for the physicians and the patients that they're missing lunches, or there's new reps that just come in and bark orders. So by doing that and being just a friend of them goes a really long way. You had 2 great cases with a new product, and this is where I would start pushing on where you think your device, your widget, is appropriate for other patients. So on the patient selection, this is, they're using 0%, this is 100%, you're right here about 5%. So 5% of patients, these are, what they are, there's a specific patient. Can you move to these specific patients in the next set of patients that really benefit from your widget? If you don't know what patients are best for your widget, you need to go study that. So I know patients A, B, C, and D are 100% best for my widget. E, F, G, H, I, my widget's a lot better than the other widgets. And then maybe the middle of the alphabet or the end, it's a little bit of the middle ground, or maybe the competitor's better. But I want to work on where my device shines over the competitor. So after these 2 great implants with a device that they wanted, that addresses their clinical need, I'm going to start messaging for the next set of patients so those can be mine. And what I want to do is I just want to make it automatic. I don't want them to think medical device Matt, come up with an algorithm where these patients go to widget Matt, and we think these patients are good for the competitor widget. And over time, I want them to say, oh, I think these patients, I'm seeing great results anecdotally. Matt's sending clinical data. He's sending resources. We feel comfortable with this set of patients. And now full circle, this small volume account is medium share with you, with your widget. And even though that isn't driving you 100% to plan, it's a significant component, and it's a significant component for your district. You always have to hit plan for your territory, but you have to help your manager hit plan. So this additional revenue and utilization of your widget is huge. And not only that is, I mentioned that this account is tied to a big IDN. So your success here is important to the success of your company at this whole IDN. And it's, everyone talks about the rising tide. The more people that are using your widget, the more it's talked about, the more people are moved from kind of an adversarial to a neutral role, or neutral to favorable. It is all a win. So this is the first case study I've done. We're talking about a low share account where you hadn't really been able to gain traction. We talked about some sales strategies and different tools to get traction. We found out that the new product launch addresses their clinical need, and we really focus on building momentum for that as we take off. And by showing up and being there and selling your brand and being kind of a trusted advisor for this very clinical widget, you have built a successful sales plan. We'll catch you later. This is Medical Device Matt.